Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What is a symptom checker app?
I think this is a pretty easy to use app that you can load on your phone, which will walk you through a number of common kinds of problems or symptoms that people might have, and they can refer to the app so they can understand some of the things that might cause it, as well as some of the things they might think about doing if they have those symptoms.
Should this app replace an office visit?
I think in many cases, for things that where it is a relatively minor kind of an issue, then maybe this is the kind of thing that could provide some reassurance or some more information about what that symptom might be caused by. But in some cases, it might point you to go seek seek medical care, whether that be getting in touch with your primary care physician for further evaluation, or whether it be getting help a little bit more urgently.
What are the best circumstances for using the app?
The app covers a wide variety of different kinds of symptoms that people might have, from things that are relatively minor to things that might be more serious, things like a runny nose and a cold, to things like belly pain or to urinary symptoms. So it's the kind of thing where you can go in, you can see what the recommendations are for those particular symptoms, and then use that to get guidance on what the next steps would be.
So what information does the app provide?
It'll give the patient an idea about when to seek help and what kind of help to seek for those particular problems. It may suggest some things that they can try on their own for symptoms that might not be immediately urgent. It might provide guidance for symptoms that might not require urgent attention, but in some cases it will direct people to seek more urgent medical assistance, or at least to create an appointment with their primary care team or their specialty physicians when they can.
Why are medical providers such as UMass Memorial creating these apps?
I think we're trying to be as patient-friendly as we can be, where we can provide tools to providers and then not only give them information, but we make it as easy as possible for patients to get through the front door here if they do need help, to reach out to their care team, and certainly if they are experiencing something that might be more significant, then they should definitely seek our care as quickly as they can.
What are some additional features of the app?
The app has a number of different features besides just checking symptoms. It also allows you to schedule an appointment, to find physicians that are available in our community, to find locations that might be near you as well. The ability to schedule appointments is based on the availability of those providers, and we can link you right to that site where you can book an appointment online. So there's really quite a few tools that are available, and hopefully we can make it do even more things in the future. The app also links directly to our patient portal, Follow My Health, which allows people to access all of their information once they've gone through the enrollment process through their primary care physician, to be able to see their medications, their problem list, and to have conversations with their providers as they wish. The patient can also see results of laboratory tests and other testing that they've had done through their provider.
Are apps like Health eCheck a growing trend in healthcare?
Hospitals, healthcare systems are trying to be as patient-friendly as possible, to reach patients in the way that they can connect most effectively, whether that's by using a smartphone, by using the web, reaching out to them in ways that they can most effectively, because when people have symptoms, when they have complaints, then they right now probably use Google quite a bit, and that may not provide you the most reliable information for what to do. So I think that having this resource, which has been developed by by experts that we trust, can help people to get the information that they need, and in a way that will also help them to get the care that they need as well.
Is there a target age for the app?
We find that a lot of the people who log into and use our portal are actually older adults. We expected initially it would probably be people who are younger who would use it most often, but older adults who have health problems, who want to track their medical conditions, and who want to interact with their care team do use the portal quite a bit. So I think that this is for anyone who has a smartphone, and these days that's just about everyone.
How does the app assist with medications?
One additional nice feature of this is that the app does have a series of medication charts, so it can give guidance about what kinds of doses you should use in children for various over-the-counter kinds of medications, and can also help you to look up other medications as well. You can even build your own medication list in the app if you'd like to. And one of the things we do want to remind people is that if you are experiencing a medical emergency, then we want you to call 911, not go check your app. Sometimes those seconds can matter, and we do want you to seek urgent medical care when you have an urgent problem.